Hi guys, today let's talk about the GIT. The GIT is the tube that runs from the mouth to the anus. It consists of the mouth, the esophagus, the stomach, the duodenum, the jejunum, the ileum, the cecum, the vermiform appendix, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and the anus. The passage of food through the GIT is regulated by valves that are known as sphincters. These are located at different points along the GIT. The first of these is the upper esophageal sphincter, which is located at the superior aspect of the esophagus. We also have the lower esophageal sphincter, also known as the cardiac sphincter, which prevents reflux of food from the stomach. We have the pyloric sphincter, which controls gastric emptying. We have the ileocecal sphincter at the ileocecal junction, which controls passage of food from the ileum into the large bowel. And lastly, we have the internal and external anal sphincters, which control passage of stool. Embryologically, the GIT is divided into the foregut, the midgut, and hindgut, depending on the relationship with the yolk sac during embryogenesis. The anatomical landmark for this is found in the duodenum, which is divided into the first part, the second part, the third, and the fourth parts. The landmark is found in the second part of the duodenum, dividing it into two halves. The foregut is proximal to this landmark, and the midgut starts distal to this landmark. The derivatives of the foregut include the mouth, the esophagus, the stomach, and part of the duodenum, the first part, and the proximal half of the second part. The midgut comprises the rest of the duodenum, the jejunum, the ileum, the cecum and appendix, the ascending colon, and part of the transverse colon, particularly the proximal 2/3 of the transverse colon. To the left of this is the midgut, and to the right, as far as the anus, comprises the hindgut. Clinically, the GIT is also divided into the upper GIT and the lower GIT. The landmark for this is found at the duodenal flexure, the point of attachment for the ligament of Treys, also known as the suspensory muscle of the duodenum. We shall talk a little bit more about this as we talk about the duodenum later on. So everything proximal to this is the upper GIT, the mouth, the esophagus, the stomach, and the duodenum. The rest forms the lower GIT. For completeness, we shall add the liver, the pancreas, and the spleen. The spleen is not part of the digestive system. This is the pancreas, and that is the liver and the gallbladder. These are not their anatomical positions, but I had to stretch them out so that they could fit in clearly. So the GIT plus the pancreas, the liver, and the gallbladder form the digestive system. When you remove these accessory organs, we remain with the gastro-intestinal tract, GIT. Now let's talk about the stomach and the duodenum. The stomach is the sac-like structure that stores food temporarily after it's ingested. It starts from here and ends here. The stomach is divided into different portions. This is the cardium of the stomach, also known as the cardiac area of the stomach. This is the fundus of the stomach. This is the body of the stomach. The whole of this is the pylorus of the stomach. The pylorus of the stomach is divided into two parts. The wider part is the pyloric antrum, and this is the pyloric canal. The stomach has two sphincters, the cardiac sphincter and the pyloric sphincter. The duodenum is divided into four parts. The first part is the superior part of the duodenum. The second part is the descending part of the duodenum. The third part is the inferior part of the duodenum, also known as the horizontal part of the duodenum. And lastly, the fourth part, which is also called the ascending part of the duodenum. Here is the duodenal flexure, the point of attachment of the ligament of Treys. Below it is the beginning of the jejunum. Now let's talk a little bit more about the stomach in cross section. Here is the line separating the esophageal mucosa from the gastric mucosa. It's called the Z line, otherwise called the zigzag line. The mucosa of the stomach is thrown into several folds, most of which are longitudinal. On the side of the greater curvature, these are known as the rugae, and on the side of the lesser curvature, these form the margin trace of the stomach, through which fluid flows from the stomach to the duodenum. Now let's look at the duodenum in cross section. The mucosa of the duodenum has two openings through which digestive juices flow in. The upper one is called the minor duodenal papilla, the point of entry for the accessory pancreatic duct. It is inconsistent, meaning it is absent in some people. And below it is the major duodenal papilla, the point of entry for the common bile duct and the main pancreatic duct. It is also called the papilla of Vater. Just like the rest of the small intestine, the mucosa of the duodenum is thrown into several transverse folds. These are known as the circular folds or the cock-ring folds. Now let's go back to the duodenal flexure and talk about the ligament of Treys, which I've been mentioning earlier. So here is the ligament of Treys, also known as the suspensory muscle of the. Here is the right crus of the diaphragm, and here is the left crus of the diaphragm. Here is esophagus, whereas this is the esophagus coming out of the esophageal hiatus of the diaphragm. So the ligament of Treys is also called the suspensory ligament of the duodenum. The area I'm shading is the area where we find the head of the pancreas in anatomic position. Now let's look at the rest of the small intestine, which consists of the jejunum and the ileum, and how can we differentiate between the two. The jejunum is shorter than the ileum being 1.5 times longer than the jejunum. The wall of the jejunum is thicker than the wall of the ileum, and for this reason that the Peyer's patches can be seen at the ileum and not at the jejunum with the naked eye. The lumen of the jejunum is wider than the lumen of the ileum. The other difference between these two is seen in the mesenteries, which are simply folds of peritoneum supporting these organs. The arteries supplying these organs form anastomostic loops. Also known as arcades. Now, the ilioarteries form more than one arcade when they are supplying blood to the ileum. On the other hand, the jejunal arteries only form one loop. Also, the mesenteric fat of the ileum is more than the mesenteric fat of the jejunum. this is the reason why the jejunal arteries are more visible than the ileal arteries. And lastly, the Cochrane folds are more in the jejunum than in the ileum. We'll now conclude our discussion with the colon. The colon is thrown into folds known as hostrations or simply hostra. There is a longitudinal line running along the colon known as the tinea. So we have from the tinea we have epiploic appendages, which are simply pads of fat. Thank you very much for watching. Please support my channel, like, comment, subscribe. Have a good day.